Moderators on Reddit have deleted a thread on the murder of UnitedHealthcare CEO Brian Thompson, who was shot and killed in Midtown Manhattan last week. A medicine thread on Reddit was closed after commentators criticized and even satirized Thompson's alleged denial of healthcare coverage to sick Americans to make profits.
Many posts, including from doctors and medical professionals, shared critiques of Thompson's business practices. One medical doctor wrote, quote, "When others' human lives are deemed worthless, it is not surprising to have others view your life of no value as well," end quote. And another said, quote, "What has bothered me the most is people that put fiduciary responsibilities, profits, above human lives, none more so than this company as run by him." Another doctor posted, quote, "I cannot even guess how many person years UHC has taken from patients and their families through denials. It has to be on the order of millions. His death won't make that better, but it's hard for me to sympathize when so many people have suffered because of his company."
Since the assassination of the CEO in broad daylight, there have been an appalling number of people coming out to applaud his death or make excuses for it. Leading the charge, in some sense, was none other than tech writer Taylor Lorenz, who sparked outrage after a post she made that appeared to celebrate, was criticized for seeming to celebrate, the gunning down of Brian Thompson. She wrote, quote, "When you see the entire internet left and right uniting around one thing, and that is celebrating the death of a healthcare CEO, you have to ask why." She went on to say UnitedHealthcare has murdered thousands of Americans by denying them coverage.
Now with us to discuss all of this is Editor-in-Chief of The Lever, David Sirota, who has done a lot of reporting on the healthcare industry. David, welcome.
Thank you. Thanks for having me.
So let's get, first of all, your overview on the reaction to this killing. It has, I think, been surprising to many people how much glee is maybe an unfair word, but certainly there has been a lot of pretty vigorous criticism of the healthcare industry after this man was murdered. What do you make of what's going on here?
Well, look, I think that we just came off an election in which healthcare was not talked about really at all among the two parties. There's clearly a lot of anger at the healthcare system in the United States right now, understandably so. A system that has put insurance companies, for-profit insurance companies, between people and medical providers. And let's be clear, that has been going on for 40, 50 years. It was fortified. It was strengthened at a moment when it didn't have to be, when there was a moment of a discussion of healthcare reform. The insurance industry's power to exist between us and our medical providers was strengthened under the Affordable Care Act. Now, I think there were a lot of things in the Affordable Care Act that were necessary and good, like regulation, insurance regulation. But the point is that even at a moment that we allegedly solved the healthcare crisis 15 years ago, it actually strengthened the power of the middleman between Americans and their doctors. So all of that's to say that the anger at health insurance companies that's out there is real. It was not expressed in any real way in the Democratic arena, small d Democratic electoral arena, but it doesn't mean that anger at the health insurance industry has gone away. And so what I think you've seen in the last week is an expression of that anger. And my question is, why isn't it more central in our politics? Our politics, our elections are the places that we're supposed to non-violently litigate these things, where that anger is supposed to prompt positive policy change, and yet the healthcare question is still basically erased from that arena.
Yeah, I can certainly understand frustration at the healthcare industry, at the process of receiving care and having it covered is so bureaucratic and confusing, and no one, of various ideological stripes is satisfied with the current system. All that said, I was taken aback at the number of comments I saw from people just really reveling in what had happened to this man. I also hoped you could explain, because I saw this a little bit of a dispute among various progressives online, because there was a framing of this as, well, that this company had just changed or gotten rid of some kind of coverage of anesthesia. But then I saw other progressive people arguing, well, actually, that was just the anesthesia lobby people who actually are paid really, really well, complaining about something that was going to take a little bit of a bite out of them. And in fact, if you have a government-run or government-providing system, there is going to be exactly that kind of needing to grapple with the price of various services, and so that was a little bit misportrayed. Could you speak to that in greater detail, or correct me if I got some aspect of that wrong?
Yeah, sure. I mean, there were those are two different insurance companies. I mean, Anthem Blue Cross Blue Shield, at the same time that all this was going on with United Health, Anthem Blue Cross Blue Shield announced that it was going to limit payments for anesthesiology services if surgical procedures go on too long. In other words, set time limits. Now, there's a debate about anesthesiologist reimbursement rates. That's a debate that can happen. But when you've got an insurance company creating arbitrary time limits on what it will cover for surgical procedures, I mean, that's like something out of a sci-fi horror movie, which I think only underscores how inhumane this system really is. We need to get back to a discussion. It was, and I said, healthcare hasn't been in our political discourse for a long time. I should correct myself a bit. In 2016 and in 2020, my old boss, Bernie Sanders, tried to put healthcare into the electoral and political context with a Medicare for all set of proposals. And I think clearly those kinds of proposals need to be at the center of our politics. We need to be discussing why we remain the only advanced industrialized economy that doesn't have some kind of government guaranteed basic healthcare system for all. You can debate whether and what that healthcare system would do, what kinds of sacrifices potentially with vis-a-vis private insurance and provider payments, et cetera, would have to be made. But I would say this about the question about doctor remuneration rates. Let's not forget that in our country, medical providers often have to take on, I think I read that it was an average of $200,000 of debt just to become a physician or a specialist. So if we're going to talk about reimbursement rates, we need to talk about how do we make medical education more affordable so people on the other end of that education system don't need to get reimbursed at rates that people find objectionable in order to pay back those debts, right? The whole system needs a full audit to get to something a lot more humane and a lot more efficient. And let's be clear, one last thing I will mention. The Department of Government Efficiency, the so-called department pushed by Elon Musk and Vivek Ramaswamy, they should be looking at, if they're worried about healthcare costs, which Elon Musk tweeted out that he was, they should be looking at Medicare for All, which the Republican-led Congressional Budget Office during Donald Trump's term said would save our country $650 billion a year.
David, when you talk about, the fact that the United States is such an aberration in this respect, you're talking my language, so to speak. I mean, I grew up with the National Health Service in the United Kingdom, which had been created in the 1940s, and obviously the United States is an outlier in that respect. If there were something akin to the National Health Service, that would remove the need for private insurance at a stroke. But it hasn't happened, and you note Bernie putting forth the Medicare for All, which also was not achieved on that occasion. I guess a two-part question. Is the problem basically the amount of money the insurance industry has at its disposal to fight these changes? And if that is the case, will that change anytime soon, or are you somewhat resigned to things being as they are for a while?
Well, I think the first part of your question is, look, we don't have a humane healthcare system because we have built a system of legalized corruption in our politics. That the health insurance industry is an incredibly powerful industry that gets its way in Congress all the time because it spends a lot of money on politics. The money that it spends on campaign finance and lobbying, this is not philanthropy, this is an investment. The return on the investment that it gets is a set of policies that puts for-profit insurers between Americans and their medical providers. So yes, the reason we are an outlier is because our political system is an outlier. It is a form of legalized corruption, as we detail, by the way, in our audio series called Master Plan, a series of court rulings and the like, policy changes to make essentially bribery and corruption legal. So the healthcare system is one outgrowth of that. Now, I would say this, at some point, money, in theory, is not able to buy everything that immiserates the public for as long as the healthcare system has immiserated us. So I do not accept the idea that we cannot get to a humane, universal, government-guaranteed healthcare system. Medicare for all is an idea. The reason it's a salient idea is because people know what Medicare is. We know how Medicare operates. It's not perfect, but there are things about it that are much better than private insurance. Surveys show that people who get Medicare are more satisfied with their health care than people who get private insurance. We know that Medicare has a 2% administrative overhead, while the private insurance industry has a 17 or 18% administrative cost built in. So we know that Medicare, it's again not perfect, but it works, and in many ways works a lot better than the private health insurance industry. So the point is, there have been times where we've gotten very close to expanding Medicare. I mean, I tweeted it today this week is the 15-year anniversary of Joe Lieberman killing off the proposal during the Obama administration to expand Medicare, lower the Medicare enrollment age, or at least allow people to buy into Medicare. And my point in saying that is, yes, Joe Lieberman and Democrats in the Senate were successful in killing it off, but it got close. And my point is that I think if there's enough anger out there, if there's enough pressure out there, I do think this can be a moment of positive change.
Mm-hmm. David Sirota, founder of The Lever, thanks for joining us. Great conversation as always, and much to think about. Thank you.
Thank you. Thanks to both of you.